Welcome, everyone, to this video on pulmonary embolism, often shortened to PE. This serious condition occurs when a blood clot travels to the lungs, blocking blood flow. It's vital to understand what PE is, how it happens, and what we can do about it. Let's dive in. So, what causes a pulmonary embolism? In most cases, the clot originates in the deep veins of the legs, a condition known as deep vein thrombosis, or DVT. Prolonged immobility, such as after surgery or during long flights, increases the risk of DVT. Other risk factors include certain medical conditions like cancer, heart failure, and inherited clotting disorders. Major trauma, surgery, especially orthopedic procedures, pregnancy, and the use of hormonal birth control or hormone replacement therapy also elevate the risk of developing these clots. Now, let's talk about the pathophysiology, or how PE actually affects the body. When a blood clot lodges in a pulmonary artery, it obstructs blood flow to a portion of the lung. This leads to a ventilation-perfusion mismatch, meaning air is reaching the alveoli, but blood isn't flowing to pick up oxygen. This causes hypoxemia, a deficiency of oxygen in the blood. The obstruction also increases pulmonary artery pressure, which can strain the right side of the heart. In severe cases, this can lead to right heart failure and even sudden cardiac death. Pulmonary embolism is a significant public health concern. It's estimated that hundreds of thousands of people are affected by PE each year in the United States alone. The exact incidence is difficult to determine because many cases go undiagnosed or are misdiagnosed. People of all ages can develop PE, but it's more common in older adults and individuals with underlying medical conditions. Certain ethnicities, particularly African Americans, have a higher incidence of PE compared to Caucasians. The signs and symptoms of PE can vary widely depending on the size of the clot and the extent of the blockage. Some people might not experience any symptoms at all. However, common symptoms include sudden shortness of breath, chest pain often described as sharp or stabbing and worsening with deep breaths, coughing sometimes with blood, lightheadedness, and a rapid heart rate. DVT in the leg, which often precedes PE, can cause pain, swelling, redness, and warmth in the affected leg. Diagnosing PE can be challenging because its symptoms are similar to those of other conditions. Diagnostic tools include a D-dimer blood test, which measures a substance released when a blood clot breaks down. If the D-dimer is elevated, further testing is needed. A CT pulmonary angiogram (CTPA) is the gold standard for visualizing blood clots in the pulmonary arteries. Other diagnostic tests include a ventilation-perfusion scan, VQ scan, pulmonary angiography, and echocardiography, which can assess the right heart's function. While there aren't distinct types of PE in the traditional sense, we can classify them based on the severity of their impact. For example, a massive PE causes significant hemodynamic instability, such as a drop in blood pressure. A submassive PE causes right heart strain but doesn't result in a drop in blood pressure. A low-risk PE doesn't cause significant hemodynamic or cardiac compromise. Risk stratification helps guide treatment decisions. The primary goals of treatment for PE are to prevent further clot formation, prevent the clot from getting bigger, and prevent new clots from forming. Anticoagulant medications, also known as blood thinners, are the mainstay of treatment. These medications can be administered intravenously, subcutaneously, or orally. Thrombolytic therapy, which uses medications to dissolve the clot, may be necessary in severe cases of PE. In rare cases, surgical embolectomy, the physical removal of the clot, might be required. Supportive care, such as oxygen therapy and pain management, is also crucial. Preventing PE is crucial, especially for individuals at high risk. Simple measures like regular exercise, staying hydrated, and avoiding prolonged immobility can help. Compression stockings can improve circulation in the legs, particularly during long periods of sitting or standing. For individuals undergoing surgery or with other risk factors, prophylactic anticoagulation may be recommended to prevent DVT and subsequent PE. The prognosis for PE depends on several factors, including the size of the clot, the patient's overall health, and how quickly treatment is initiated. With prompt diagnosis and treatment, many people make a full recovery. However, PE can be fatal, especially if it's not diagnosed or treated promptly. Research continues to focus on improving diagnostic methods, developing new anticoagulant medications, and identifying novel therapeutic targets to reduce the morbidity and mortality associated with PE. Studies are exploring the use of direct oral anticoagulants (ACE) in specific patient populations and investigating the long-term effects of PE on pulmonary function and quality of life.